With flu season coming to a close and allergy season ramping up, we understand many of you may be experiencing symptoms similar to COVID-19. So what do you do if you think you're sick? I sat down with our experts to learn more.
If I think I'm sick, what should I do?
Well, if you think you're sick, first and foremost, I wouldn't do anything differently than I would have done 6 months ago or 3 months ago before the coronavirus was an issue in our community. There's not a necessity to get tested, and there's not a necessity to get evaluated. Obviously, if you are sick with the coronavirus and you go to a facility to get tested or evaluated, you could infect somebody else. And so I think the main message is that if you would not have sought care prior to the coronavirus being in our community, you probably don't need to seek care with the coronavirus in our community.
If you wouldn't ordinarily seek help, then I would not seek help just because you are concerned about coronavirus. So if you're having trouble breathing, if you're having pain, if you're having chest pains, if you're having severe fever that you can't break, chills where you can't get out of bed, fatigue, those things that are out of the ordinary for a typical run of a common cold or even maybe like the flu, it's worthwhile to get checked out by your primary care provider or perhaps even doing an e-care visit through telemedicine.
So what happens to a patient who goes to a Norton healthcare facility after they believe that they have COVID-19 symptoms?
So if you're having symptoms, first of all, try to call ahead, notify your provider, notify the emergency department if that's where you're going, that you're coming ahead so we can be prepared. We will immediately place a mask on you and place you in a private room. And then our providers will come in with their personal protective equipment, maintain it as much as possible, 6 foot distance while they're asking you questions, and then proceed to examine you, determine if you require further testing, or perhaps you can be discharged home and self-quarantine until your symptoms are resolved.
For additional information about COVID-19, visit nortonhealthcare.com/COVID.